Welcome to REBA's Inside Track podcast. I'm Maggie Williams, REBA's Content Director, and I'm here today with Debi O'Donovan, Director of REBA, and Dawn Lewis, REBA's Content Editor. COVID-19 has turned workplaces and individuals' lives upside down over the course of the last few days. It has raised many questions and concerns about how the pandemic will affect work and the role of reward and benefits within it. In this podcast, Debi, Dawn and myself look at some of the key issues emerging from our industry and from within the REBA community. So I'd like to start off by talking about some of the bedrock elements of reward. Debi, what are you hearing in the market about pay and other basics such as holiday policy?
It really feels like employers are still reeling from the impact of coronavirus at the moment. So even though some have been planning for weeks, we still are getting more questions into the REBA team than answers right now. Lots of questions around pay. So things like, what are other employers doing about paying their employees who've had to spend more time at home, but these people can't do their particular jobs from home? Another one was asking us, has anybody provided hazard pay for employees who can't work remotely? So we aren't seeing clear answers on this yet. However, it's quite good to see that a number of our members have said that they are absolutely reassuring staff that they will continue to be paid even if they cannot work from home. Clearly, changing pay is a legal and contractual issue, but we are seeing a few actions around pay already. Probably most common from the people we've been hearing from is employers who are deferring or reducing pay rises or cancelling them altogether. Next most common is that we're seeing a reduction in working hours for some staff. Now, both of these types of actions we saw come up in the 2008 downturn. So I would expect that was only 10 years ago. So most reward professionals are familiar with these mitigating tactics. A smaller number of employers are telling us that they are deferring or reducing upcoming bonuses. Interestingly, relatively few are planning to cancel bonuses altogether. And hopefully that's a sign that employers generally are seeing the current state as a temporary situation. And most want to keep those employees who are talented, who are achieving, who are hitting targets, they want to keep them engaged. From what we can see, a relatively tiny proportion are enforcing unpaid leave at this stage. I think that could change in coming days and weeks, so we need to keep a watching brief on that. It's very early in the process of, we've just been caught on the hop, really. Far more common is employers saying that they're going to offer the option of extended sabbaticals to staff. Again, something we saw quite commonly back in the 2008 downturn. I expect not many staff could afford to take this up, but it's one way to perhaps trim the wage bill that's a win-win. But that whole area of holiday and leave now appears to be in disarray, from enforced holidays, cancelled holidays, down to due to border lockdowns. So I think that will be a topic we might need to come back to at a separate podcast, because we're getting lots of questions about people rolling over pay, holidays and leave and so on.
Dawn, with so many employees affected by COVID-19, sick pay arrangements have really hit the headlines. What are some of the considerations for employers and employees?
So sick pay falls into two broad categories. Firstly, contractual, and second, statutory sick pay. So as I'm sure you've all gathered by now, statutory sick pay, the rules around that have been completely relaxed. So that is now applicable from day one. So if anybody is advised to self-isolate, regardless of whether or not they have symptoms, then they are entitled to statutory sick pay. The elephant in the room around statutory sick pay is the fact it's only £94.25 a week. And so that realistically is unlikely to cover most people's essential needs and requirements for paying the bills and so on. So we'll come back to that later. With regards to contractual sick pay, from what we've been hearing from our members, there's actually quite a positive note on that. Actually, a lot of employers have looked at COVID-19 and have said that actually they will support their employees during this time. So a lot of employers have told us that they are going to be providing full pay to anyone in isolation, regardless of their contractual position. So that includes people who are perhaps new joiners who wouldn't necessarily be entitled to full pay at that stage. Although they have also noted that that policy will be kept under review given the numbers of people taking that up. So that's, it's a moving ball game, this one. And also other employers have been saying that they're going to offer additional leave to help people, and also people who are carers who are at home. And other moves have been things like relaxing the need for GP certificates to qualify for sick pay. So it's great to see that so many employers are actually supporting employees' financial wellbeing and making a really positive change there. But of course, not all businesses are going to be in a position to do this. So later on, we'll look at how else businesses that aren't able to offer full pay to everybody, other methods and options that are available to them.
Debi, when we look at the broader picture of benefits, can you tell us about some of the approaches we're hearing from REBA members?
We're actually seeing a lot of practice strategies around employee benefits. Probably the top one that we're seeing coming in to the REBA offices is employers telling us that they are adding a virtual GP or on-call GP services to their benefit package directly in response to COVID-19. Others who perhaps already have these offered to staff are extending the services to all staff and workers who perhaps didn't qualify before. They've just rolled it out to everybody. Those with these services in place are putting out communications and signposting, reminding staff what's on offer and how to access them. I was speaking to one large employer just 3 weeks ago who told me she didn't realize that a virtual or digital GP service came free with the group PMI they had at their organization. So if you don't think you've got that as an employer, it's probably worth checking in with your broker or your insurance provider to see if that service is available. The other benefit that we're seeing being extended, added or upgraded for better services is the Employee Assistance Program. We've spoken to a number of employers who have extended this globally for all staff around the world to get access. Suddenly budgets are becoming more available, and leadership teams around the world are saying to benefit directors, wellbeing directors, that's fine, just get that in place, let's roll this out. But again, the signposting, recommunicating the existence of the EAP seems to be a very common action. On perhaps a more sensitive side, I know a few employers have wondered if staff have their life assurance beneficiaries up to date. I'm very sensitive. How do you mention that? Difficult to broach that topic, but one to bear in mind that might become important. And quite a few benefit managers have been on the phone to their brokers and their insurers to double check whether their medical or life insurances have exclusions around pandemics. So a lot of queries going in, and I hear that from the life officers as well, that they're taking a lot more calls on that. One employer tells us that they've been hit hard by the fallout from coronavirus. So they really are focusing on helping employees maximize net pay and trying to reduce any cost to the organization itself. So offering things like the option to opt out of taxable benefits, and are promoting their voluntary benefit scheme. A few say that they are looking at reducing pension contributions. Now, this again will depend on employment contracts. We may well see contribution holidays rise again, which could be a better short-term solution rather than a long-term change. And we're keeping an eye on that. There's discussions around auto-enrollment and whether there be a contribution holiday there as well. So a number of actions around benefits, so we'll keep a watching brief.
Dawn, I'd like to come back to the elephant in the room that you talked about earlier around the effect of statutory sick pay on people's finances. What do you see as some of the longer-term implications for financial wellbeing?
Well, I think as we all know, Maggie, the financial resilience among many employees is actually very, very low. So the recent figures from Joseph Rowntree Foundation show that there's about just over 1 in 5 working age adults are currently in poverty. And the Money Advice Service also found that there's 16 million people in the UK who have savings of less than £100. So that gives you a really good idea of the potential consequences of COVID-19 on anyone who is living effectively hand to mouth, which from those statistics suggests that an awful lot of employees are. So it's a really big issue that employers need to consider, really. So because of that, we know that SSP is unlikely to cover people's outgoings, and a lot of people are going to become under a lot of financial stress, particularly where this is something that it's not just going to be affecting one person in the household. It may well be affecting both residents, or however your household is made up. It's not just affecting one person, it's affecting the whole family. So this is a really, really big issue to tackle, and of course it feeds into things like mental health and various other elements of well-being. So what can employers do to support their staff? I mean, Debbie's already touched on a few ideas in terms of promoting discount schemes to help people with cost savings on their weekly shops, perhaps even encouraging people to look at their service providers to save a few pounds here and there on different electricity bills and so on. The EAPs are really important as well in that way. They can give money advice and signpost to debt services to help people to manage their debts, because debt is actually going to be a massive, massive problem. And employees need to know whether they can get any kind of breaks on their bills and outgoings. Other facilities that some employers have are things like wage streaming. So again, looking at whether you can give employees access to their wages sooner, or loans. Credit unions, for example, will give emergency loans to employees as well. So some employers already have those in place, and those again will be quite important to helping employees get over any kind of self-isolation period that they might be in until they can return to work again. Those are the sorts of things that are available to employers, but more broadly speaking, the government's introduced various measures. So those include things like mortgage payment breaks, and they've also promised that private renters won't face eviction, and anyone who's vulnerable won't have any of their energy supplies cut off. So there's slight reassurance there that employees will be protected and they won't be made homeless by the outcome of COVID-19. So looking more long term, it's going to be a lot about how to get employees back onto their feet, how to help shore up their financial resilience. And I suppose finally, government is helping businesses as well. So it's delayed the implementation of RI 35 until April 2021. And there's also a whole package of measures to support businesses, from business rate holidays to grants and loans and so on. So one of the main issues is making sure that your business is still there.
This is a lot for employees to take in. How is this affecting their mental health, Debbie?
Maggie, by far the majority of questions coming into REBA are exactly around those topics. People worried about the mental well-being, the social well-being, particularly of staff newly working from home. And as you say, the financial pressures. I think many employers were caught on the hop. They were in the testing phase of working out how they were going to face up to coronavirus when the government advice came in for everybody to work at home, and all the focus went straight into IT systems, video calls and so on. And it's perhaps people just started to draw breath now to think about what does this actually mean for staff and their mental well-being. In terms of the importance of social connections and talking to people, I'm not going to repeat those here because there's a vast tsunami of information out on the web about that, and some really good advice out there. But as somebody who has primarily worked from home over the last 5 years, I can testify that it is something that needs adapting to. I enjoy it, but it doesn't work for everybody. And I'd like to flag up groups of people who will probably need extra looking after, especially on the mental well-being side. So those who've perhaps been recently bereaved, and I'm speaking from personal experience here, coping on your own and now having to be home alone more often than you used to needs careful thought. I expect somebody who's newly divorced, or where there's been a relationship breakup or estranged, would feel similar. So those staff members, those workers, perhaps need a bit more support and connection from their colleagues and line managers and others around them. On the flip side of those, a lot of people are now at home with other people all day in a way they're not used to. And we have seen, sadly, stats of domestic violence rise in parts of the world where there have been lockdowns due to coronavirus. And add into the mix people stressed about their finances, for example. There is an issue here. There will be a proportion of your staff, sadly, who have an abusive family member and who no longer have that escape of getting to work. How can you support them? You probably don't know who they are, but how do you make sure that they know that they can reach out to you? A number of my disabled friends are very worried right now. They cannot get their medicines easily. Online shopping, as we know, is a bit of a state of chaos at the moment, although the government is trying to work with the retailers to sort that out. But while the government is working out what can employers do to support their disabled staff, who will probably be under quite a level of distress about the situation. And of course, if people do get coronavirus, how can an employer help? As we record this, I personally have flu-like symptoms that could be coronavirus, clearly mild, as I wouldn't be able to do this podcast, but I do live in central London. The chances are that is what it is. And my number one fear is I don't have quite enough paracetamol as I'd like, despite trying to buy some, and I'm having to self-isolate. So there's going to be thousands, tens of thousands of others like me out there who perhaps are living on their own or self-isolating with family. How do you support staff when they actually do get ill? And we have had some queries come in from REBA members asking about that. And Maggie, I've got just sort of one final thought that I'd like to throw in, if I could, at this point, on a positive note. I think for reward and benefit professionals or for company leaders generally, it's quite tempting to have a knee-jerk reaction right now and go in hard and fast, say we've got to cut costs just to survive. But we're already aware that there are plenty of organisations out there who are using this time to plan an aggressive recovery. We should come out of this on the front foot. And so I would say those of you who are thinking in HR and reward terms about your employer brand, and if you were to recover quickly once the coronavirus has faded and the panic has faded, what decisions are you making now about your reward and benefits and staff that will put you on the front foot with the best talent that's most adaptable to what will undoubtedly become a new world order? That would be my question I'd put out.
That's a great note to end on, so thank you very much, Dawn and Debbie, for your thoughts today. We'd like to know more about your longer-term plans and your current COVID-19 challenges. You can contact us at maggie.williams@reba.global, and remember that you can also share knowledge with reward and benefits professionals in our peer-to-peer REBA Link network and through the content on our website. Thanks for listening today.